Hello everyone, I am Binari Pereira and today I am going to discuss about a published case study on an ovarian granulosa cell tumor in a savanna goat. This case involves a 2-year-old female savanna goat. Initially she had normal estrous cycles, but over the time her cycles became prolonged and despite the normal breeding she didn't conceive. Because she was a valuable animal, owner decided to get her properly examined. So prolonged cycles and the infertility were the key starting clues in this case. Ultrasound showed that the right ovary was noticeably enlarged and multicystic, and also during the laparoscopic artificial insemination, the right ovary was seen again in the same abnormal way. And based on these findings, the owner decided to go for the unilateral ovarectomy to remove the affected ovary and to go for the further examination of it using the histopathology. Once the ovary was removed, the gross findings were very striking. The size of the ovary was around 15 to 20 centimeter, which is much larger than normal, and its surface looked multicystic. And when cut open, there were a lot of cysts and areas of hemorrhages and necrosis visible, and all these findings strongly point toward an ovarian tumor. Microscopically, the ovarian tissue has been completely replaced by a tumor, and the cells were cuboidal to polygonal, lining the cystic spaces in single or multiple layers. And all these features are very typical features of granulosa cell tumor, which is a sex-coat stromal tumor. So to confirm the diagnosis, immunohistochemistry was performed. When the Vimentin stain was used, the tumor cell cytoplasms appeared as strong brown in color. This is typically because of the DAB chromogen in their cells, in their cytoplasms, which is actually used for detection of positive staining in immunohistochemistry. So when we say Vimentin was positive, it means that the cytoplasm of the granulosa cells turned a clear dark brown in color, indicating they are of mesenchymal or stromal origin. They were negative for pancytokeratin and desmin, ruling out the epithelial and smooth muscle tumors. When considering differential diagnosis for a multicystic ovary, we look at things like granulosa cell tumor, ovarian hematomas and ovarian carcinomas. But for ovarian hematomas, it usually doesn't affect the animal's cyclicity and the infertility. And for ovarian carcinomas, they would be positive for pancytokeratin. So altogether, with the appearance of the ovary and the immunohistochemistry results, there is the clearest diagnosis of the ovary affected with the ovarian granulosa cell tumor. This case is very interesting because the granulosa cell tumors are very rare in goats. They can produce the inhibin hormone, which suppresses the FSH hormone that cause the abnormal cyclicity and the infertility in animals, which actually perfectly explains the prolonged cycles that were seen in this doe. So the good thing was that the tumor was benign, and once the affected ovary was removed, the goat recovered well and she returned to normal cyclicity, conceived naturally and produced healthy offsprings. So unilateral ovarectomy has a good prognosis in such cases. To summarize, if you have a doe with infertility and one large ovary, granulosa cell tumor should be on the differential list. Ultrasound, histopathology and immunohistochemistry confirms the diagnosis, and ovarectomy as the treatment restores the fertility of the animal. Thank you.